And we have invited two distinguished guests to introduce you and update you the information and answer your questions. The first expert we are going to introduce you is Deputy Director of the Provincial Health Commission, Mr. Wei, and Mr. Deng Xiaochuan from the Provincial Level Pharmaceutical Supervision Bureau. So right now we'd like to invite Mr. Wei to introduce us the background information. With the emergency mechanism being launched, the whole province has been focusing on the early detections, early preventions, and also early controls. We have amassed a lot of the pharmaceutical drugs, and we have conducted the apological research and also the quarantines for the patients with follow-up effort for the other suspected cases. Up to now, the total confirmed cases is reaching 549 cases with 27 discharged and 17 deaths, among which 160 are among the heavy infected patients. So far we have treated and traced 3,650 people, among which 877 people has been discharged, and there are 2,700 people under supervision and also under the management. Currently, there is a lot of patients which were stuck in the hospitals. According to the experts, it is because this is the seasons for the flus, and with a lot of the patients who are infected with flus, together with the novel coronavirus patients, they are all gathered in the inpatient and outpatient department. Some of the patients, they might get to the hospitals in fear. That's the reason why all the patients, has really hard access to the hospitals. Currently, across all the province, there are 524 different hospitals and clinics prepared for the respiratory disease, among which they are all above level 2 hospitals, among which in the Wuhan cities we have 61 different hospitals and clinics with their respiratory and fever department open up for the patients. They are fully capable of doing the detections and diagnosis of the patients. After the diagnosis, we are going to treat the patient on the sites. If we cannot diagnose the very root of the patient's syndromes, we are going to transfer them into the hospitals which are capable of diagnosing. So for the current reflections of the general public that the patient is very hard to enroll in the hospital, we have get a fully training, and we have made sure that all the doctors is very ready to battle against the novel coronavirus. For those patients who can be confirmed, we are going to treat them on the site on that hospital. And secondly, we have spread the coverage of the hospitals. We have required for all the hospitals who are capable of doing the epidemiological examinations. We required all the hospitals to do the epidemiological examination on sites. This is going to help us to early detect, early quarantine the patients, increase the treatment efficiency. Thirdly, we have identified 15 different hospitals to receive all the patients who have very heavy symptoms. We need to make sure that all the patients is going to be treated in a timely manner. We are also calling to the general public that who are those of the patients who get fever, who have something like the cough and shortness of breath, please enroll into your local hospitals and into your community hospitals. Do not be impacted by the untruthful information, and do not panic. Thank you very much for your cooperation. Thank you very much, Director Liu. So currently we are going to invite Director Wei to give us more information from his side. Dear friends from media, good afternoon. Thank you very much for the concern and support for our Pharmaceutical and Supervision Management Bureau. So after the novel coronavirus infected pneumonia occurred in our province, we have formed a control team for the provincial level pneumonia controls, and we have launched the level 1 emergency controlling mechanisms. And we also get updated information about the medical devices production mechanisms. We launched a specific quarantine and research to increase the supply for the medical devices and also the supplies. We are trying our best to make sure that all the medical devices and the pharmaceutical drugs is in full supply. Firstly, we have launched a specific supervision examinations. We have examined all the pharmaceutical and medical devices producing companies, especially those who are capable of producing the medical masks, protective suits and clothing, diagnosis trials. And we have monitored all of these drugstores, and also we are fully prepared for any counterfeited product in the pharmaceutical and medical devices markets. Secondly, we are ready to be guaranteeing the market for the medical devices. I have led a team to visit all the producing companies for the masks and also the body temperature testers, and we should be ready to make sure that all the producing companies, including the Gaode Hongwai, Huanggang Wenjian, Zhejiang Aomei company, is operating in full capacity. We also required the Guokong Hubei, Jiuzhou Tong, among other different pharmaceutical producers, to increase their supply in the markets. We should make sure that their production is in full qualities and they can meet the demand in the markets. Thirdly, we have launched emergency evaluation mechanisms. We have opened up green channels for the medical masks, protection suits, diagnosis kits, and also among all the other drugs and also medical devices. For the next steps of our work, we are going to fully do a good job according to the requirements about the provincial governments, and we are going to be people-oriented and people-centered. And secondly, we are going to do a good job about our day-to-day monitoring about the drugs and also the pharmaceutical products. And we are going to have the special teams responsible for the examinations of the pharmaceutical drugs and also the medical devices. We should guarantee the good qualities of all the medical devices and all the drugs. Thirdly, we are going to coordinate all the supplies for the drugs. We should make sure that all the companies to produce all of the drugs in full capacities, and we should get the support from the national level pharmaceutical supervision bureaus, and we are going to let all the drugs and also the medical devices to be a part of the green channels. Thank you very much. Right now the floor is open, and we welcome for all of your questions. Currently, some of the companies are producing some of the experts-oriented medical masks and also the protective suits. Can it be used under this emergency mechanism? Thank you very much. Let me answer this question. This is one of the public concerns. For the medical masks and also the protective clothing, it is a very special product, and it is actually guaranteeing the safety and health of the general public, and especially our medical workers. And it is a very important part for us to prevent and control the disease. Medical masks and also the protective clothing should be under a national level control. And for some of the companies who are producing the medical masks and also the protective suits ready for the exports, they did not register in the National Bureau. According to the current law, it's not allowed to be used in the Chinese market under the emergency circumstances. According to the general arrangement of the provincial government, we have launched an emergency evaluation mechanism for this part of the product. We have evaluated their quality because the product produced for other countries, they also have different uses. And for the different product have different uses. Once the companies and the producers is applying for our mechanisms, we should be sure that whether it is applied to the national circumstances, whether it's being applied to the national standard. And we are going to give the company a feedback, a suggestion for their usage of their product. If the product is in line with our requirements under the general arrangement of the government, it can be allocated to the local hospitals. But of course, we are going to register this bunch of the product on our record. And we should also make sure the qualities of this product. Thank you. Any other questions from the floor? I suggest you to left all the questions, and we are going to give you several different feedbacks for the questions. Thank you. Thank you very much for joining our press conference. Tomorrow afternoon at 3:30, we are going to have another press conference. Thank you very much for joining our press conference. Thank you.